prevalent and serious diseases in the world, but still many people remain unaware of its toll on public health. To know more about the magnitude of hepatitis and what WHO is doing to tackle this public health threat, I kindly invite to the podium WHO's Regional Director, Dr. العالمى. RD, the floor is yours.
Your Excellency, Dr. Adawi, Minister of Health of Egypt, dear colleagues, ladies and gentlemen, it really gives me great pleasure to welcome you all to WHO today on the occasion of the World Hepatitis Day 2015. The holding of this global event here in this region is a great opportunity for all of us to remind ourselves of our collective aim and responsibility to end the suffering of people in the region and in the world as a whole from hepatitis B and hepatitis C. I am really pleased to welcome His Excellency Dr. Adawi, as well as Mr. Charles Goh, who is the President of the World Hepatitis Alliance. And as you know, our region is among the regions most affected by hepatitis in the world. Every year, around 4.3 million people are infected with hepatitis B virus and 800,000 with hepatitis C. Estimates indicate that more than 17 million people in the region currently suffer from chronic hepatitis C. And I must say that viral hepatitis has long been neglected, despite the fact that both hepatitis B and C are preventable. Hepatitis B is manageable, and we know that hepatitis C is curable. When preventive services are not available, the number of people acquiring hepatitis will continue to increase, and when treatment is not accessible, people will continue to suffer, and we continue to lose lives unnecessarily. We must also remember the enormously negative impact on the economy and social development because of loss of productivity, premature death, and expensive healthcare costs. And unfortunately, many people in our region still acquire the infection in healthcare settings through unsafe injections, as well as through unscreened blood transfusions. Mother-to-child transmission is the main cause of hepatitis among children. And furthermore, many people who are at risk of HIV are also at risk of hepatitis B and C infections simply due to unsafe sexual relations or due to injecting the drug use. Yet, we have a wealth of experience on how these transmissions can be prevented. So, ladies and gentlemen, prevent hepatitis B and C is the theme of this year's World Hepatitis Day. We must do it together, and the suffering and loss of life must end. Together, we will stand up for the challenge to ensure that the healthcare is safe, that people are informed about infection and how the disease is transmitted and how it can be prevented. We will work to ensure that newborn infants and adults at risk are vaccinated against hepatitis. And we will work to ensure that harm reduction services are available and are accessible for people who inject drugs, and that people have easy access to means for preventing the sexual transmission of hepatitis. Yes, we have missed past opportunities, but we now have global commitment, we have vision, and we have a roadmap. And we have a long way to go, but we are now on the right path. Hepatitis has been the focus of intensive discussion at the 67th session of the World Health Assembly in May 2014. And the Assembly passed a comprehensive resolution urging countries to develop and implement coordinated multi-sectoral national plans for preventing, diagnosing, and treating viral hepatitis. And the resolution also calls upon the United Nations agencies and other international and regional stakeholders to include the prevention of hepatitis in their work and programs, and to support high-burden countries like Egypt in providing sustainable funding. And for the first time ever, WHO is developing a global health sector response strategy for hepatitis. This strategy will increase political commitment, and it will set the framework for concerted global action to eliminate hepatitis by the year 2030. WHO and partners are working to improve access to quality, affordable medicines and laboratory technologies. And at a regional level here, WHO has given a special priority to hepatitis prevention. In October last year, a technical session on hepatitis, chaired by His Excellency Dr. Adawi, was held on the day preceding the 65th session of the WHO Regional Committee for the Eastern Mediterranean. For those of you who do not know what the Regional Committee is, this is the annual ministerial meeting that takes place here every year, which is the main governing body for WHO in this region. The session raised awareness of new opportunities for scaling up national efforts to prevent and control viral hepatitis B and C. And last month, the regional office convened a meeting that brought together national focal points from different member states of this region, regional experts, partners representing civil society organizations, to provide regionally specific feedback on the global hepatitis strategy and to discuss ways to develop and strengthen national hepatitis responses. So this regional office is currently in the process of developing a regional framework to support member states in developing their national multi-sectoral plans. I will take this opportunity to urge countries of this region to make the most of the new opportunities and rising global commitment and momentum to develop and implement a strong hepatitis response. And WHO obviously remains committed to supporting countries reach the ambitious prevention and treatment targets of the global strategy that are also inscribed in universal coverage. So ladies and gentlemen, I would like to take this opportunity to acknowledge the leadership and the progress being made in Egypt in its provision of treatment of hepatitis C, and also to acknowledge the commitment to dealing with the problem across its population. I would like to congratulate His Excellency Dr. Adawi on the progress being made to the lives of people living with hepatitis C in Egypt. WHO will again continue to support and work closely with the government of Egypt in defeating hepatitis, and I really look forward to benefiting from your experience here in Egypt in order to set a model for other high-burden countries in this region in hepatitis treatment and control. So in closing, I would like to address our colleagues in the member states of the region, the 22 member states of the region, assuring them of WHO's commitment to supporting them all in their journey to set up and implement effective hepatitis control programs. Thank you.
Thank you, Ardi. Allow me to remind you that you can have instant interpretation to English channel 2, to Arabic channel 1. الأخوة الصحفيين هناك ترجمة فورية. القناة رقم 1 للعربي والقناة رقم 2 للغة الإنجليزية. To know more about Egypt's commitments and action to prevent and treat hepatitis, I kindly invite His Excellency, the Minister of Health, Dr. Adel Adawi. The floor is yours.
Honorable Dr. Alaa, WHO Director for the Eastern Mediterranean region, respectable Dr. Henk Beckman, WHO representative for Egypt, respectable WHO colleagues and guests. Good morning, everybody. Allow me to welcome my colleague, Dr. Layla Skander, who joins us today because Dr. Layla is a real partner for us in our campaign in defeating viral hepatitis in Egypt and with upgrading the level of the medical services in slum areas. So thank you, Dr. Layla, for coming to this event. Let Let me start by thanking the WHO for taking this initiative to raise global awareness on hepatitis today here in Egypt on the occasion of the World Hepatitis Day. I'd like to sincerely express my appreciation and regards to Dr. Alwan for hosting this year's official celebration in Cairo. As you know, global concern is increasing about viral hepatitis as a real threat to public health in Egypt. In Egypt, the viral hepatitis is a serious concern to the general public and is a burden on our economy. Today, I'd like to share some reflections on the Egyptian experience and the efforts to control viral hepatitis in Egypt. Viral hepatitis C disease was spread throughout Egypt during the 60s and 70s of the previous century, in concurrence with the bilharziosis treatment. Unfortunately, unsafe injection was the main cause of this spread, and it became one of the largest spread of a blood-borne disease. Nowadays, up to 150,000 patients are added annually. In 2008, the Demographic and Health Survey noted a hepatitis C patient infection rate of 10% for the age group of 15 to 59 years old. In 2015, this hepatitis C infection rate for the same age group has dropped to 7%. And this positive trend was made possible through a combination of prevention and treatment efforts. The Ministry of Health in previous years took a proactive, concrete actions to control this disease. This includes the treatment of more than 350,000 patients with the routine interferon regimen with up to 60% cure rate since 2006. And there are also approximately 2.3 million cases of virus B infection in Egypt. Viral hepatitis B vaccination is part now of the routine vaccination since 1992, with up to 95% effectiveness in preventing infection. The ministry believes in the importance of enforcing evidence-based, up-to-date approaches and the governance to continue building on the previous efforts. Out of this belief, the Viral Hepatitis Unit and the Consultant Committee for Prevention were established in 2014 and consist of distinguished academic and clinical calibers dedicated to transform the vision into reality. In October 2014, we have launched the National Plan of Action for Prevention, Care and Treatment of Viral Hepatitis 2014-2018. This action plan aims at decreasing the incidence of the disease and preventing chronic cases from developing life-threatening complications as liver cirrhosis and cancer. The 7 pillars of the strategy are promoting surveillance, blood safety measures, infection control measures and safe injection, educational programs and raising awareness of providers and communities, vaccination, care and treatment, and definitely research. Ladies and gentlemen, now the current priority of the ministry is to increase the access of hepatitis patients to treatment. In this perspective, the ministry negotiated with Gilead Company last year to provide the newly FDA-approved Sovaldi to the Egyptian market at a low fraction of the international price. We facilitated patients' access to treatment through enabling website registration, the number of outlets where patients can access treatment to 53, and now we are assessing the facilities that could serve as new outlets. The ministry and the government implement this strategy and definitely support the coverage to the patient through the health insurance organization and the patient treatment on the expense of the state. This approach gained success and popularity, and the number of patients that are registered on the web portal reached 1,155,000 patients early in this month. And around 130,000 patients have already received treatment, with a response rate up to 93%. His Excellency President Abdel Fattah al-Sisi launched an initiative to provide treatment for 1 million virus C patients. In response, the Ministry of Health worked towards achieving harmonious collaboration between Egyptian pharmaceutical manufacturers and civil society to align efforts towards implementing this initiative. As a further step, the Ministry of Health is also planning to pilot a viral hepatitis elimination model in Aswan Governorate in Upper Egypt. For national media campaigns for public education and awareness, the Ministry is collaborating with the WHO, the CDC. This collaboration also includes the introduction of highly sensitive, specific, and affordable diagnostics. Ladies and gentlemen, I believe that Egypt can build on the groundwork laid so far, and the sustained control for viral hepatitis will only be achieved through multi-sectoral integration and the participation of all necessary stakeholders. Finally, allow me to welcome all of you and wish you an enjoyable event. Thank you very much.
Thank you, Your Excellency. I take this opportunity to welcome again the Minister of Urban Development of Egypt, Her Excellency Ms. Leila Iskandar. Thank you so much for your attendance. Now, we will show a documentary about hepatitis in Egypt. It's a short video for about 5 minutes.
Egypt, the land of pyramids and great heritage, is once again rising to face yet another challenge. Viral hepatitis is one of the world's most pressing health problems, causing acute and chronic liver disease, killing close to 1.5 million people worldwide every year. Egypt has one of the highest global burdens of hepatitis C virus infections. It is estimated that 7% of the population between 15 and 59 years are chronically infected. Unfortunately, 150,000 new persons are believed to be infected annually, and tens of thousands die every year. In 2006, the Ministry of Health established a national committee for the control of viral hepatitis. The committee adopted the first national strategy for control of viral hepatitis in Egypt and established a nationwide treatment program. In 2014, the Ministry of Health launched the Plan of Action for the Prevention, Care, and Treatment of Viral Hepatitis, in collaboration with key national and international stakeholders, including the World Health Organization, the U.S. Centers for Disease Control and Prevention, or CDC, and Pasteur Institute. The plan focuses on the 7 main components of viral hepatitis prevention and control: surveillance, infection prevention and control, blood safety, hepatitis B vaccination, care and treatment, communication, and research.
The national plan, which we launched along with the introduction of the new treatment on 16th of October 2014, highlights the important goals of the Ministry's viral hepatitis program and reflects the country's continuous commitment to controlling this epidemic by making the effective treatment available and preventing new infections.
The new sofosbuvir drug is the first highly effective and approved direct-acting antiviral agent for nationwide treatment of hepatitis C virus infection. This medication is safer than old treatments and in combination with other drugs, it has been shown to cure more than 90% of those completing the treatment. In a global first, the drug has been made available to Egyptian patients for $900 US, which is 1% of its international price. The ministry will be introducing other approved and highly effective medications consecutively, in addition to encouraging the local manufacturers to produce pre-qualified generic versions to effectively implement the elimination program in the shortest time possible. Before introducing the new treatment, the National Committee for the Control of Viral Hepatitis, which is part of the Ministry of Health, established a web-based registration system to schedule patients' appointments to receive treatment. By mid-2015, almost 1 million patients with known hepatitis C virus infection have registered and are being evaluated by experts at more than 50 treatment centers for eligibility to receive the new medicine according to national guidelines. It is anticipated that 150,000 people will be treated by the end of 2015 and 300,000 additional patients by the end of 2016.
وخدت العلاج وربنا شفاني والحمد لله وبالدكاترة كويسين هنا ويعاملونا معاملة كويسة والحمد لله.
Treatment is only half the story. An enormous effort is also being made in prevention.
The World Health Organization supports Egypt in all aspects of hepatitis control, both in treatment and in particular prevention. WHO provides support in immunization, communication and blood safety standards and training. In addition, Egypt has been selected as one of the 3 pilot countries for the new WHO Global Injection Safety Campaign.
This campaign aims to reduce unnecessary injections and transition to the exclusive use of syringes that can only be used once. Egypt has plans to manufacture these new syringes, which will gradually replace traditional ones in the healthcare system. This will greatly help to reduce the number of hepatitis C virus infection occurring in health centers. WHO and CDC are also supporting other prevention interventions, including a national media campaign. With the vision of eliminating viral hepatitis in mind, Egypt is planning to pilot an elimination model in Aswan Governorate in Upper Egypt. The model will include all components of prevention, care, and treatment. Egyptians have shown in recent years that they can change the course of history. In collaboration with committed stakeholders, the country can and will overcome the viral hepatitis C challenge as well.
Now that we know the burden of hepatitis in the region and in Egypt, we will learn more about the situation globally in terms of access to prevention and treatment. I would like to give the floor to Dr. Charles Gore, President of the Hepatitis Alliance. Sorry, Dr. Gore, the floor is yours.